Hey guys, Brock from Command here, and today we're going to bust some medical myths. To start off with, the myth that salt is bad. Salt is not bad for you. It's actually super important to have plenty of salt. Too high of salt can be bad, but getting enough is crucial to avoid fatigue, headaches, lightheadedness, especially if you're physically active and you don't have particularly bad high blood pressure issues or kidney dysfunction. So that is a myth. Not everyone needs to watch their salt very closely. Number two, that antibiotics can help with colds or the flu. Colds are typically caused by some type of virus, as is the flu. Common colds are typically caused by a coronavirus of some sort. And this is not talking about COVID. Coronavirus is a broad umbrella type of viruses. And if you take antibiotics, if you have a common cold or the flu, it can actually lead to bacterial resistance, meaning that those antibiotics that you improperly used, if you try to use those again later, you can actually get bacteria in your system that does not respond to antibiotics. It builds a resistance against antibiotics that your body's been exposed to, that those bacteria have been exposed to, and they become resistant to it. And so that's a problem for individuals, but it's kind of a community-wide problem. We see a lot of antibiotic resistance, and part of the reason is because of overprescription for common colds. Really where we see that come to play is with sinus infections. So sinus infections are only caused by bacteria in about 0.5 to 2% of cases. So by and large, antibiotics should not be used for sinus infections, but people feel better if their doctor prescribes them an antibiotic for their sinus infection, even though it's typically not good medicine to. And if you go based on the medical literature, even if you have a bacterial sinus infection, if your immune system functions well and you don't have particularly severe or concerning symptoms, it's best to not take antibiotics at all and just monitor symptoms, make sure they go away on their own. Signs that you might need antibiotics is if your sinus infection lasts for a couple of weeks or longer, if you have severe sinus pain, if you have a pretty legitimate fever. Sometimes antibiotics are needed in those cases, but by and large, antibiotics are not needed for sinus infections. Myth number three is that eggs are bad for you. For one, eggs have little, if any, effect on your cholesterol. Eggs are actually one of the most nutritious foods that you can eat. They are literally, they provide the most bioavailable protein known to man. And so it beats everything. It beats chicken and meat and all kinds of high protein foods. So for most people, eat eggs, eat lots of eggs. The more eggs you eat, the more nutrient dense food and quality bioavailable high protein you're getting, and you're probably gonna eat less of the refined carbohydrates and other things that you would otherwise eat. So just those three myths. Salt is not bad for you. Antibiotics are not beneficial for colds or flu, and typically are not even needed for sinus infections. And eggs are not bad for you. They're one of the best foods you can possibly eat. Lastly, instead of featuring a command service this month, we're going to talk about the big beautiful bill for just a moment. As I understand it, that the bill defines direct primary care as a qualified medical expense under IRS rules. So qualifying HSA and FSA funds can be used for your DPC fees for individuals up to $150 a month, and for families up to $300 a month. For qualifying DPC clinics, for instance, DPC clinics that don't take insurance, which is most direct primary care clinics, don't take insurance, so that many will qualify. Also, DPC clinics need to not provide any in-hospital services. Again, that falls in line with what most DPC clinics do. It's usually just outpatient clinical medicine. It is best to check with your CPA or FSA, HSA provider regarding your coverage, but for a long time, using your FSA has been kind of a gray area for paying for your direct primary care, but as of now, as I understand it, you can use your FSA account up to $150 individual, $300 a month. And for HSA, I believe in January of 2026, January 1, 2026, you'll be able to use your HSA if your HSA qualifies for covering your direct primary care services. So guys, with that, just we're trying to shorten the video newsletters a little bit, make them a little bit more digestible and easier. Thank you guys for joining us for this video newsletter, and we will catch you guys in the next one. Thank you.